We are your vaccine authority here at Eyewitness News, and there's been a major shift in Connecticut's vaccine plan. The state is no longer taking a tiered approach by profession or health conditions. So here's a look at the new plan released by the governor yesterday, starting March 1st. Just to remind you here, teachers and those 55 to 64, will be able to get vaccinated. Then on March 22nd, it's those 45 to 54, April 12th, 35 to 44, and then lastly on May 3rd, 16 to 34. That is the order right there. Medical experts have been saying it's to reach herd immunity status with COVID-19, our kids need to be vaccinated. But when will that happen? Channel 3's Waterbury Bureau Chief Dennis Valera breaks down the timeline and the science behind why kids are typically vaccinated last.
As each state moves along with its vaccination rollout, one demographic that hasn't been touched yet is kids. Connecticut Children's Medical Center's physician-in-chief, Dr. Juan Salazar, says vaccinating kids is key to restricting spread, to getting to any kind of normalcy.
Kids, for the most part, are going to be asymptomatic. They won't have any symptoms of the disease, but they may be shedding virus. So if we can shut off that element of transmission, we're going to be in really good shape.
Under the state's vaccination plan, 16-year-olds can start getting vaccinated on May 3rd. Any younger? That depends on the Pfizer and Moderna trials happening with kids aged 12 to 15 right now. That data is expected by the summer.
Once you know that the vaccines are safe and effective in that population, then you start moving it down. Kids are not just little adults.
Dr. Salazar says vaccine tests are always done in age brackets because our immune system changes as we grow. With ages 12 to 15 being looked at now, the next age group would be 5 to 11-year-olds. In regard to COVID-19, adults were prioritized for vaccines first, since the virus's severity increases when older.
While Connecticut Children's isn't involved with either trial, Yale University is testing the Pfizer vaccine in 12 to 15-year-olds, seeing if 2 doses is effective and tracking any side effects. Researchers there are optimistic.
If we can go by anything we've seen from the adult trial, I think our hopes are high that the vaccine should work equally for kids.
As is Dr. Salazar. He's not worried about side effects in kids either.
In fact, I suspect they will do better than the adults. Generally, that's the case with vaccines in kids, that they tolerate them quite well.
Dr. Salazar points out the Pfizer vaccine is already cleared for 16-year-olds. He says it shows it shouldn't be too far off for 12-year-olds. He estimates as soon as May.
If we get the data for the 12-year-olds, which hopefully will come very soon, then I feel very confident also that kids age 5 and above will have an equal efficacy from the vaccine.
In Hartford, Dennis Valera, Channel 3 Eyewitness News.